Hello, my name is Dr. Gwenda Boys. I'm president of Chesapeake Physicians for Social Responsibility. Our chapter was formed in the early 1980s as Baltimore PSR, and our work was educating medical students and the general public to the medical consequences of nuclear war. In this century, we've expanded to becoming Chesapeake PSR, representing the whole state, and expanded our mission to the existential threat of the climate crisis. We played a leading role in a statewide ban on fracking in Maryland. In nuclear war prevention, we co-founded Prevent Nuclear War Maryland, which helped pass Back from the Brink resolution in both Baltimore City and Montgomery County. We're part of an environmental coalition subcommittee that is using environmental justice and equity lens to evaluate environmental legislation in Annapolis this next session. We're part of a community-based coalition that stopped one incinerator from coming into Curtis Bay, a part of the city with more stationary toxic sources of pollution than any other community in the state. And now they're working to close down a nearby municipal waste to energy incinerator by organizing a comprehensive zero waste campaign. We're honored to be part of this wonderful community-based work. We're a small chapter, and sometimes our work in coalition is simply to endorse and then get our supporters through emailing to reach their elected officials and to make calls. And we've done this in campaigns like Cancel the Rent campaign, Marylanders for Food and Farm Worker Protection, and now Count Every Vote. Hats off to Juliet National, who has made this work possible and easy for a chapter like ours, sharing tools they have, pairing supporters' addresses with the relevant elected officials. When you hear this message, I hope you will know that, and we will all know that the 50th state nation has ratified the UN Treaty on the Prohibition of Nuclear Weapons. And then the 90-day countdown starts for when this treaty comes into full effect. This is monumental, and we have so glad to be part of this work. Now let's hear from Dr. Art Millholland, who's done anti-nuclear work for decades, Dr. Allison Kramer, and pre-med student Joseph One, who are renewing ties with, hoping to renew ties with pre-med and medical students. And finally, Mr. Darryl Carrington, who's our lobbyist in Annapolis and helps to make our advocacy work more effective. Let's hear from them.
This is Dr. Art Millholland. For 35 years, the thing I think about is nuclear weapons. The threat has been going on for at least that long. And now, as you can see, we have reached 100 seconds to nuclear extinction midnight. Climate change is part of that extinction threat. Nuclear weapons are even bigger threat. This threat is ignored and misrepresented in the media. Being part of Chesapeake Physicians for Social Responsibility gives me a way of addressing this in a way that is informed, mindful, and purposeful. One of the things we participate in is Back from the Brink, a program to reduce risk. As part of that program, I developed some cards for activists and legislators that seem to help in educating the activists to remember the elements of Back from the Brink and remind all the other issues that go along with that, including the Anti-Ballistic Missile Treaty, the IMF START, and the like. Also, we must keep in mind the United Nations Treaty on the Prohibition of Nuclear Weapons. We are intent on bringing to the public's education the existence and importance of the United Nations Treaty on the Prohibition of Nuclear Weapons. And again, being in PSR lets me be not just faithful to that goal, but effective. Thank you.
It is an honor to be working with the Chesapeake Physicians for Social Responsibility. I'm Allison Kramer. I'm a combined family medicine, preventive medicine resident and I am here to tell you about my work with CPSR to help connect pre-medical students and medical students to our efforts. With the COVID-19 pandemic, we have a little bit of a challenge in reaching out to students right now. Our traditional way would be to have an in-person lunch and draw students in with a presentation and some speakers. And now we're faced with the opportunity to reach students virtually, which could potentially have wider impacts, allow us to reach more students. We have some wonderful colleagues here that I'm working with on this, Richard Bruneau and Joseph Woon, who are doing a wonderful job to reach out to students at a college here called Goucher. And we are hoping to have our first meet and greet event soon. We want to just impart onto students the importance of the risks of climate change and nuclear war, but also many other existential threats that have become a lot more prominent lately, especially racial divides, perhaps even misinformation in social media, the destruction of what true facts are. These are all threats that we face right now, and medical students are really primed. Pre-medical students are really primed to learn and grow in this area, and we want to mentor them. So we hope that this is a really exciting and very fruitful venture. Thanks.
Hello, my name is Darryl Carrington, and I am the Managing Director of Carrington and Associates, LLC. Carrington and Associates has been lobbying in Annapolis for the past 15 years. We represent governments, nonprofits, labor unions, sports and entertainment, and the private sector. We have been honored to serve as the government relations team for the Chesapeake Physicians for Social Responsibility for the past 6 years. During our time together, we have championed a number of environmental and social justice initiatives that we have moved from concept to major legislation that can be easily replicated across the country. Maryland was the first state on the East Coast to ban fracking in a bipartisan fashion. The bill was introduced by a Democrat and signed into law by a Republican governor. Thanks to the positive relationships we have cultivated over the years, the Chesapeake Physicians for Social Responsibility has become a trusted advisor to legislators on both sides of the aisle. In addition, we have been able to take on some of the state's most divisive social issues of our time and work within a coalition of like-minded organizations to achieve marriage and gender equality in Maryland, as well as ensuring paid sick leave, banning the shackling of pregnant women, and also removing youth from solitary confinement. We've ended the death penalty in Maryland and helped lawmakers bridge their understanding of how social issues impact public health. It is an honor to work with such dedicated and knowledgeable physicians, scientists, and public health professionals as we continue to work to remove the existential threats that affect human health, including an end to the continual reliance on fossil fuels and nuclear power. Thank you for your support of our efforts, and we hope to continue to move our society forward.